Anaphylactoid is pretty much like the anaphylactic. Anything is oil, that means like is a fake one. That, for example, for the drug, they have the anaphylactoid reaction. They have the same clinical sign, and the clinical sign is from the histamine, but the beginning is not from the IgE. They have their own receptor on the cell membrane of the mast cell. You can see like a morphine, codeine, polymyxin B, or some people they allergen for the berry. They have their own receptor. But the sign is happened like as the anaphylactic shock. That's why we call anaphylactoid. Yes?
Did you say that so anaphylactoid includes the IgE as well?
No. Anaphylactic shock is based on is based on the IgE. They can be drugs or food or anything that causes an allergen, and body recognize as an allergen. And IgE gonna bind that allergen and release a histamine. But the anaphylactoid reaction is not based on the IgE. Now these drugs, they have their own receptor on the mast cell. And drug bind on the receptor, gonna cause release of the histamine. We call that anaphylactoid reaction. My question is, if the drug that cause anaphylactic reaction and the drug that cause anaphylactoid reaction, which one have the faster reaction? Anaphylactic or anaphylactoid? Between. What do you think? It's have an immune related. Yeah. Think about anaphylactic. Once you have just a tiny amount of the allergen, the IgE gonna recognize and have a lot IgE included, right? And release the histamine. But when you compare for anaphylactoid, that means you have the good amount of an anaphylactoid substance that bind to the receptor and that cause the same amount of the histamine. Does it make sense? That means the anaphylactic is more serious. Both of them is serious, but anaphylactic is more serious. Mm-hmm.
So I thought you asked which one would be faster.
Faster, yes.
So wouldn't anaphylactoid be faster? Because with anaphylactic shock, you need multiple exposure to the antigen. Or how does, maybe I'm just confused.
Okay, because once they have the action the same time, the anaphylactoid, they have the high enough of the substance that can cause an anaphylactoid. But for anaphylactic, once you have the tiny amount of an allergen or antigen, the IgE can recognize that. And they pull out a lot of IgE and happen in like a second or a minute.
But isn't that assuming that you've already been exposed to it?
Yeah, it's happened, for anaphylactic, it happened like a second time or third time once you approach to the allergen.
But can't anaphylactoid happen at the first time you're
Yes,
exposed?
anaphylactic at the first time. Oh, I know what you mean. Like, I mean for, I assume like the antigen have the second approach, yeah. That's a difference. I make you more confused? Anyone have allergy to not to like a shellfish or something like that? No, okay. If you have an allergy, you will learn about that very quickly. Yeah, because it happened to me. I cannot eat a shellfish. I don't know why. When I was young, I can eat it, but right now I cannot eat it. It's happened the first time when I have food. Yeah. Once I have at lunchtime, and I went to the movie theater. Around 2 hours, I have the effect, I have the reaction on that. But the third time, I never learned. The third time I made the shellfish. Once I finish my lunch, I have a running nose already. It's just like a minute. Once you have it, just like, okay, histamine just released right away, yeah. But the first time, like 2-3 hours, yeah. Yeah, but when the movie is done, my friend is like, what happened to you? My eyes just like swollen and all just red, yeah. Yeah. Oh, and another thing I would like to mention that epinephrine is a drug of choice to treat both anaphylactic and anaphylactoid reaction. First, because they can have the effect to bronchodilation. And the second thing, epinephrine, they have the function counteract on the mast cell to inhibit the release of histamine. Yeah. And in the human, the one who have the asthma or have the allergen problem, and the antihistamine, it doesn't work anymore, they say they can use the COX, the NSAID to treatment, to help them to treatment for the allergen. Because the prostaglandin, they have the counteract reaction to release histamine too. But I never seen veterinarian to use to treat many allergy, yeah. This line is a word I said from the previous one. Anaphylactoid is a non-immunological reaction. And it's not just only from the agent, it can be from the physical stimuli, like the coldness or sunlight. Or some people, they have the rash, like itchy after the exercise, because they have the cholinergic effect. You see the cholinergic effect right here. Acetylcholine stimulating the release of the histamine. Yeah, people call like they're allergic to sweat. Yeah, or they cannot do exercise because they're allergic to the exercise, something like that. And this is a clinical sign in dogs. This one is not from the vaccine, it's from the insect bite or the bees, and they have the edema from the mucous membrane, and you will see like the one have the thin what do you call it, the thin skin, like the under the eye area or the mouth area. What did histamine do, and that causes swelling? And the histamine, the guy who names the Lewis, they found they have the triple response of the histamine. They call the triple response of the Lewis. The first is come like a response. Like if you have the bee allergy, not the serious one, not the anaphylactic shock, it's the bee allergy or the insect bite. The one you scratch it, they have the red spot on this. And the red spot gonna be have the red flush we call flare. And that's stimulated by the neurological response. And have the will, because they increase the capillary permeability. Gonna be red, fair, and real. For this principle, we use in the clinic application for the intradermal skin test. You will learn in the dermatology. We would like the animal that have the allergen that cause the allergy, like from the atopy or something like happen. They have the panel of different type of the allergen and inject as an intradermal route. And the allergen that cause the effect in the patient gonna have rate, fair, and real from that. And we're gonna measure the diameter of the real once you compare with the positive control. And the positive control, we're gonna inject with the histamine. Normally, they put like the last one, like a positive control. But if you can see this one, this allergen, they have the effect to this animal already, right? This one, this one, this one, this one. That's an application to use the histamine, just only this thing, intradermal skin test. This is the list of the histamine receptor. You don't need to memorize all things, but you need to know 2 receptors, histamine 1 and histamine 2. Histamine 1, they have the effect at the central nervous system, and that can cause wakefulness. Once you inhibit it, it's going to cause sedation. And histamine 2 is a gastric secretagogue, as I mentioned earlier. Is the one stimulate to cause the secretion of the gastric acid. We're going to talk a lot in the GI pharmacology, but we will not talk today. And now we go to the drugs. It's an antihistamine. They can differentiate based on the function. The first is the physiological antagonist that antagonize of the function that comes from the histamine. Anaphylactic shock can cause the bronchoconstriction, right, and increase permeability at the capillaries blood vessel. Use epinephrine to stop the constriction at the bronchus. Is this a drug of choice to treatment acute anaphylactic? Like EpiPen, when the person they have the nut allergy or bee bite allergy, they need to have the EpiPen. That's epinephrine to injection right away. And the second one is a methylxanthine. Not that we're going to talk about because this one has only effect to the bronchoconstriction that causes bronchodilation. The drug is aminophylline. And the other one is a glucocorticoid because it's gonna recruit a lot of inflammatory cell, right? When the histamine release, the glucocorticoid gonna stabilize the cell and decrease the inflammation. That's one. Dr. We're gonna talk about this next week. Is prednisone, dexamethasone, prednisolone, methylprednisolone, yeah, this kind of thing. The second antagonist, histamine antagonist, is a prevent release of the histamine or serotonin. We not use in a small animal, but I saw they use in horses. The horse have the upper respiratory disease. The drug is a camelin sodium. It inhibits the release of histamine from the pulmonary mast cell. The preparation is an inhalation form. But in the horse, they have some apparatus. It's like a balloon, yeah, I'm an open one balloon to have, yeah. And they can use for the prophylactic to treat bronchial asthma. And the last category is competitive antagonist. Or once we mention antihistamine, this is the class people want to think about that. This kind is a competitive to bind the receptor, histamine 1 and histamine 2, but today we're going to talk just on histamine 1. We didn't call this.
Why is that medicine, the comolactin, sodium, why isn't that given to small animals again?
I don't know. They use in cat as well, but I didn't saw a lot. They use in dogs. In cat, they use for the chronic respiratory disease, especially for the asthma. They use, but we don't have the good evidence to support the Cameroon can treat the asthma as well. For the antihistamine, in the pharmacological term, we didn't call the antagonist, we call the inverse agonist. If you can see this curve, this is the response, and this is the drug concentration. As we know, the agonist, once you increase the concentration at the receptor, they have the more effect, right? For the partial agonist, they have decreased the effect once you compare to the full agonist. But for the antagonist, it just block the effect and no happen from the receptor. But for the inverse agonist, it's not just only block, they have the inverse effect. Like they stimulate to secretion of the histamine, they stop release and stop production of the histamine as well too. Or like if they cause the broncho dilation, and for the inverse agonist gonna cause the bronchoconstriction. They have like a different effect. Can I make you confused? No. As I mentioned earlier, like the anaphylactic shock or allergen, it's not only histamine that causes the clinical signs. So antihistamine is not good to use as a sole therapy. Basically, they use as a combination for the other drug to treatment that condition. And we use for treatment allergic condition in dog, especially for atopic dermatitis. In cat, we use for the asthma. And another clinical indication for the antihistamine is the to prevent or treatment of the motion sickness. Antihistamine or histamine 1 inverse agonist, they have the six drug classes together. They differentiate based on the chemical structure. You don't need to memorize all the class. You don't need to memorize this thing here. Just the one thing I bore out, like a class 2, they have the benzyl or called diphenhydramine, dramamine, dimenhydramine. And the class 3 is a chlorpheniramine, and the class 4 is a hydroxyzine, or we know as atarac. And we didn't use in the class 5. We have 6 drug classes together, but the first 5 we call as the first generation. And for the class 6, we call second generation or the newer antihistamine. Oh, you know, yeah, like a creatine, loratadine, Certex, cetirizine, or Aroga, you can see from the over-the-counter drugs. What is the difference for the first generation and the second generation? It's different that the first generation can cross to the blood-brain barrier. And once you have this first generation, you're gonna feel sedated or sleepy, right? Sleepiness. But for the second generation, the newer drug cannot cross to the blood-brain barrier. They have the effect just the peripheral area. No sedation, no drowsiness. the therapeutic use in veterinarian field, the one that we use is a hydroxyzine, or we know the commercial name as a Atrac, and cetirizine. Cetirizine is a second generation. We use to reduce the pruritus, especially from the atopic dermatitis. But the effect is not that as effective once you compare with the glucocorticoid. So some practitioners, they use to combine with the glucocorticoid to reduce the dose of the glucocorticoid. But you cannot use the antihistamine, just a sole therapy, to treat that condition. Hydroxyzine is the first antihistamine we use to treat dermatitis. But hydroxyzine is a product. They need the metabolite become as a cetirizine, and cetirizine is the active metabolite. And again, in cat, they use to treat the chronic respiratory disease, especially for the asthma. Because they said for that condition in cat, they have accumulation of the mast cell in pulmonary area, or eosinophil, and they're gonna release histamine and serotonin, and to use that to minimize cause of the histamine release. But again, you cannot use